Good morning, Alexandra and Ruth. I'm just saying hello to people as they pop up. Hello, Dawn. And hello, Heather.
Good morning.
And Nancy.
Good morning.
All right.
Morning, Vince.
Hey, Peter, how are you?
Good, thanks.
Good morning, Heidi.
Huh?
I was saying also good morning to Heidi.
Good morning, all.
And good morning, Jacqueline.
Good morning.
Heidi got a haircut.
I got desperate and went out in the backyard with my scissors. Haven't done that since I was 4 years old, and I got in trouble for it back then, but I'm glad I did it this time.
I cut my own bangs. I stood in front of the mirror for like days with the scissors with my teenage boys going, "Don't do it, Mom, you don't know what you're doing." And then I finally just did it. And I don't know what I'm doing.
Yeah. But you pulled it off.
So good morning, Joanne.
Good morning.
All right. We'll wait just another minute or so, and then we'll get started. Hi, Leslie. Hi, Rich. Hi, Al, Tracy, Michael. And Lucy's coming on. So let me start by saying who I am. I am Vince Jackson, the Executive Director of the Greater Northampton Chamber of Commerce. Good morning and welcome to you all. And we're so excited that you've joined us for this community conversation this morning with Joanne Marqusee, the President and CEO of Cooley Dickinson. Before we get into the chat with Joanne, I just want to set up a few housekeeping rules. We are recording this session because we believe there will be some great information that comes from it. And my staff and team member, Jess Thompson, is here to help me navigate the chat room for any questions and to also let people in as they continue to arrive. We want this morning's conversation to be free-flowing and a great dialogue to ask Joanne whatever you'd like. And we're going to begin with her opening up with a few comments about whatever she'd like to share. And then I have put together just a few questions in two buckets. One is general COVID-19 related questions, and then questions specifically about Cooley's services and reopening plans. And of course, there would be plenty of time for you to ask your questions. And I know some people have already informed me that they have to leave. So at any point in this conversation, you certainly don't have to wait. Just ask your question, and we'll take it from there. So with that, Joanne, I don't think you need much of an introduction. You are certainly a strong leader with an incredible presence in this community. So we want to say again, thank you and welcome. And just thanks for your leadership throughout this whole pandemic and all that you've done to keep us informed and to keep us safe and to provide the health care that residents in our community needs. So thank you to you and all the folks at Cooley for doing that.
Thank you.
At this point, I'd like to just turn it over to you to get it started.
Thank you. And obviously, the credit all goes to the amazing staff at Cooley. They've been extremely not only hardworking, but compassionate at a time when people really need it. And also thank you to the community. It's really made a difference that the community has been so supportive. I think it's one of the reasons that our incidence of COVID is relatively low, but also made a tremendous difference to our staff to know how much they were cared for, respected, and appreciated. So where are we now? We just to give you some comparisons, at the sort of height of the COVID surge here at Cooley, we had up to 20 patients in the hospital. Obviously, that is a small percentage of the total number of patients with COVID, since most do not need hospitalization. We then started tracking down, and then there was an outbreak in the nursing homes, which was a little late to come to our community, but did hit bad like it hit throughout the state and the country. So we did work closely with the nursing homes to try to mitigate the impact of that, but they struggled. I feel for them. It was a very hard time. So we have been pretty steady the last couple of weeks. We've been around 6 to 8 patients. We might have a couple of days lower than that. They do continue to be patients who stay here a long time. But we feel like we're past the surge, and now, particularly with the governor's announcement over the weekend, moving forward with recovery. So for us, the 2 important messages to the community, and it's for some people going to sound like they're inconsistent, is we are in recovery, and we very much are open for providing care and want people to feel comfortable and safe coming back to care. And I'm happy to talk about all the ways that we make it safe. We have seen, as have many healthcare systems, the impact of non-COVID patients waiting too long for care and coming back, either not coming in at all and then calling their doctors days later and they really should have been in the hospital, or coming in late with having appendicitis for days and it bursts, or having a heart attack and not getting cared for. So we want to make sure people come back, get care. We still have lots of telemedicine, so if they don't feel comfortable coming in, many things can be cared for in that way. On the other hand, or at the same time, while we are past the surge, we don't want people to relax at all in terms of following all the best practices of hand hygiene, mask wearing, and social distancing. And so hopefully we can be role models for that, because we'll continue to have universal masking and all sorts of special procedures, because what we don't want to do is see a second surge. So that's, I think, all of the challenge for us. How do we start getting back to some new normal without causing a second surge? So we have started last week with our reopening, or as we say, really expansion, because we never closed. Calling to those patients who had perhaps had procedures or visits scheduled just at the beginning of COVID. It was okay maybe to wait 2-3 weeks. We all, can remember that back in March, it seemed like, oh, this will be over soon. So calling them and saying, now really it's getting more urgent. So those patients have been coming in. Again, a lot still doing telemedicine, but with the option to come into the practice. We continue to have what we call our respiratory infection clinic, so that patients with respiratory illness, whether COVID or not, but suspected, or COVID positive patients who need blood draws, can go to a separate clinic. And so for all the other patients, they can feel more comfortable coming into their primary care doctor or their orthopod or their surgeon, and not be as concerned that there could be COVID positive symptomatic patients in the waiting room with them. But now we are starting to open up more, but mainly we're looking at how do we limit the volume of patients so we don't go from 0 to 60 and suddenly have so many patients here that we're not really making sure to have the social distancing and the time to clean the rooms more than ever in between. So that really is practice by practice specific. And they are trying to triage to get those who need the care most in quickest. And then once they see what the volume and the schedule is like, to add on top of that. So as I said, we'll continue with universal masking, both for staff and patients and visitors. And you might have seen in the governor's announcement over the weekend that visitors are now permitted at hospitals. We are working out the process to make sure we can do that safely. It will still be limited. I think it's one visitor per patient. But we had only heard that on Saturday, so we want to make sure we have the processes to really screen the patients coming in, make sure they know how to wear their masks appropriately and all of that. And also how and when patients can bring a colleague or a friend or a family member with them to a visit. So I know it'll create some frustration among some people in the community because they hear the governor's announcement and they think, great, I can come in. But our commitment is to continue to make sure we're keeping people as safe as possible. You may have seen or will see some community advertising and education about the encouragement for people to come to get care when they need it, and all the procedures and processes we do to keep people safe while they do that. Another issue I'll just touch on, because I know people have lots of questions, is about testing. So we test every inpatient, and we are, now that we're doing procedures, are testing in advance anybody scheduled for a procedure. That doesn't mean that if you are found to be COVID positive that you can't get your surgery or your colonoscopy or whatever it is. We're not doing too many colonoscopies right now, but it means that we have a different level of personal protective equipment that we use if the patient is COVID positive. So in addition, we have our drive-through testing capability right here on the Cooley campus. We have each sort of couple of weeks expanded the criteria of patients who are allowed to get tested. We still don't have the testing capacity I think everybody in the nation wishes, although we are actually have a little bit more than we've been using. So the current, we've been testing for a while, anybody who was symptomatic, certain populations like nursing homes, all patients, all employees, any healthcare worker with any kind of symptoms. But recently we also opened it up to those who were known to have contact with somebody who was COVID positive. And we actually are not seeing that huge an increase. So we still have, if more people want to come get tested, but we certainly don't have the capacity for sort of the entire community to come in and get tested. We anticipate keeping that drive-through clinic open at least through the summer, and we'll see where we are on testing then. It changes, every few weeks. They could be at home testing by then. We don't know at this point. So with that, I really would rather open it up to questions and see what people want to hear more about.
Great, thank you so much for that broad overview. Just a couple of follow-up questions. One is, you mentioned that people in the hospital right now, the patients are staying a little longer. Can you define what a little longer means, and what's the cause of that increase in the length of stay?
So COVID patients are very complicated, and those who are in the hospital are very sick. So non-COVID patients aren't staying any longer, but the COVID patients can be in the ICU for a week to 2 weeks, and that is not typical. Usually people are in the hospital 4 to 5 days.
Okay, great. And are all the Cooley affiliated practices throughout the region open as well?
Yes, I'm just thinking if there's anything that's not open. Julia, anything that's not open?
The only thing that's different is Northampton Urgent Care, but
Right.
all of the medical practices in Northampton, Amherst, and all the other towns, they're all open and operating.
And really have been throughout this, even though
Yeah.
for a lot of them they were mainly doing telehealth. I guess endoscopy was closed except for emergencies and those kinds of things, but people still need that care.
Excellent. Now, in the last couple of weeks, we have seen massive crowd gatherings with the protests. And I say kudos to those folks who jump out and march for equal rights. But with that has to be some concern about a surge, or you see some people with masks, you see some people with gloves, but you just don't see social distancing. What will you do to anticipate, I guess, having more tests? Because I've heard mixed things about testing capability, and how will you think about what do you think the health community will be doing to address this potential increase in people who need to get tested?
So first of all, in order to open up, we had to meet not just the state's requirements to start expanding care, but our parent organization, Mass General Brigham, used to be known as Partners, has an additional set of criteria. And part of that is that we have to make sure that even while we're expanding services, we continue to have surge capacity, because we know there could be a second surge. And while we were able to quickly open up last time, you know, we don't want to sort of scurry around like that. So we do continue to have extra ICU capacity and ways to quickly add that ICU capacity as well as med-surg. So we feel pretty confident that any reasonable size reintroduction of the virus into our community will be able to care for, although we'd obviously prefer not to see that. So yeah, I mean, I think we want to continue to say to people, absolutely, you know, go out and protest. It's a really important issue and a public health issue, and wear masks. It is, you know, better that it's outside. And so if you wear masks, then, you know, it's all a question of risk. If you wear masks, you can be a little less careful on the social distancing, and wearing masks correctly is really important as well. But it will be hard to tell. We will see in the next couple of weeks if it had any increase, whether we can really attribute it to that. A lot of those folks are young, so hopefully they can withstand if they do get the virus. As I said, we actually do have more testing capacity right now than we're using. So, for example, on a typical day, we do around 80 to 100 of these tests on this drive-through, in addition to all the inpatients and some employees. And we could do 150 or more. So again, I don't want an announcement to go out to the community, everybody come in to get tested, but if people are nervous and feel like they were exposed during the protest, they can come get tested. But we also want to remind people testing is not some magic solution. You could test negative today and be positive tomorrow, and you should continue to do all those same social distancing, masks, and hand hygiene, even if you're negative. The testing is almost really only helpful for the very few who end up testing positive, which is just so they then know to even go further in quarantine. We have pretty low percentage of those who are testing positive right now. But yes, if people are concerned, they should call their primary care physician, who can then refer them for a test.
I'll ask just one more question, and then I'll open it up. And I know, Heidi, you submitted a question, so I'd like you to ask that. But as you think about testing, what's the efficacy of contact tracing, and how will that play out when you consider these large crowd gatherings, and knowing that you're trying to trace it back to where people were? How effective can that really be?
You know, I think nobody quite knows the answer to that. I think it is definitely worth trying to do the contact tracing, and I'm glad in our state that they stood that up quite early. I know that people are having, that the contact tracers are having problems, or have been having problems with getting people to answer their phones. So, you know, more information is better, and knowing that you're a little bit more at risk and maybe should get tested is a good thing. But again, it is not, it doesn't stop us from all having to do what we have to do. I think it's a more important tool to have a sense of where the pockets are and what the general trend in the community is, so that you can then manage your reopening, knowing whether the illness is again surging or not. But you know, and we've had these discussions with the local colleges as well, that it's not like if you test all the students, that takes the risk away.
Absolutely. Thank you. So Heidi, I'll allow you to ask your question.
Thanks, Vince. Good morning, Joanne. Thank you for
Good
being
morning.
here.
Hi, Heidi.
Actually, I have so many questions. I'm not sure which one I submitted, but I think it was this one. So unless you have it there, Vince, I'll ask it. Joanne, I heard you say the other day something that made perfect sense, which was in this reopening phase and looking like months and months ahead, we have to, it's our time to be more vigilant and doing all the things that we're doing to flatten a curve that we know is probably going to loop up and down. You probably don't have an answer here, but I'd love your sense of it better than all the lay people that I talk to. This is the sort of how does it end question, but really what I'm thinking is like, is our final, you know, place where we start looking back at this as history, is it not until there's a vaccine? Is it not until 80% of the population has had it and there are enough antibodies out there that nobody's getting really exposed anymore? Is it just kind of like constant vigilance for the rest of our lives? Can you address that in some way? I don't really know.
Yeah, I mean, I'm not, you know, an ID doc, so take this with a grain of salt in terms of my level of expertise, but obviously we all think about this all the time here. I mean, I think particularly in our area, it is unlikely we're going to get to herd immunity, because the good news is that we don't have that much illness here. The bad news is we don't have that much illness here to get to herd immunity. So, you know, the ranges of percents of the population in Massachusetts, you know, could be 5%, 2%, 10%. It's nowhere near the 60 to 80 you need for herd immunity. So I don't think we're going to get that. So I personally do think we're not back to whatever one that we won't see this as history until we have a vaccine. Now, whether, you know, if the rates stay low and we don't have a second surge, and there isn't enough illness in the community to sort of spread a lot, then that will obviously make us be able to start feeling quasi-normal, whatever normal was. The antibody testing is interesting. I mean, it's still, I think, really in the, you know, research stage of how accurate it is. Because if it's really only, you know, 50 or 60% accurate, then having all these people do an antibody test to know whether they've been exposed, and it's unlikely it's high right now, isn't going to help that much. But we are part of, you know, the organizations that are doing a little bit of that research and doing some very limited testing on inpatients to start to get a sense of how accurate those tests are. So I think we all just have to, when we read things in the press, I didn't mean that, except if Michael writes it, then it's obviously accurate. But just when we see things, particularly in the social media, or particularly things, announcements from drug companies or testing companies, that we take it, that we just be careful not to jump to conclusions about, just because there is a test doesn't mean it's got a high enough accuracy for it to really be useful. And sometimes that can be really worse because people are relying on those results and they may not be true. Sorry not to have a better answer that we can all enjoy ourselves again in the fall. So I see somebody asked about the funding. So do you want me to address that, Vince?
Yes, please.
So we did get some funding from the federal government. We got about $5.5 million. That was about 6 or 7 weeks ago. So that sounds like a lot, but in fact, we have already lost $15+ million, and we'll continue to lose millions of dollars every month. So the federal funding in no way covered our losses, and we are no different than every other hospital, certainly in the state, and my guess is in the country. So these numbers sound really big when you hear it from the feds. I am hopeful, I used to say confident, now I'm only hopeful that a second tranche of funding will be available, but it will never, we're not going to get the support we need from the federal government to make up for the incredible losses in the healthcare industry, as in many industries. So we're going to be facing some tough challenges around our finances. We are very appreciative of the community support, but the loss of revenue has been significant.
So Leslie, why don't I ask you to ask your second part of your question around testing for everyone.
Okay.
Good morning. I was just reacting, Joanne, to your comment that with the kind of analysis of whether people who are protesting or demonstrating were going to have an increased number of COVID cases. And I guess I was wondering, Governor Cuomo has made a strong plea for everyone who is demonstrating in New York to go and get tested. He's opened up quite a number of new testing sites, especially in New York and Long Island. And I guess I wonder why you are reticent to do the same. Is it because we don't have enough tests, or you disagree with him?
Yeah, I don't know if I've thought about it that way. I mean, we don't have enough tests. So I understand there were about 4,500 folks at Saturday's protest. There were maybe 1,000 plus the one before, and that's only in Northampton. So yeah, we do not have the capacity to test thousands. We have the capacity to test, 150 a day. So over time, we could get to that. So that's one issue that across the country, and we're actually in better shape than some places where they can't even test the people who are coming to their site for testing. So it's hard to kind of think about, let's open it up to a whole bunch of people that we know we can't meet that. And then again, I think it's a hard question. If we had all the testing in the world, should we test everybody? And unless we're going to test them over and over, it's going to give this false sense of security. But of course, catching those few that are positive might be helpful. I think it's a really hard question to answer. Also, I think, have any of you had the test? So I have not, but boy, it is not pleasant, is what I've heard. And I think people don't know that. So I think that it would be unlikely that all of, particularly the younger people, would say that sounds like a great idea. So I think it's, it's just a question of, is that worth the resources and the focus when 3 days later somebody could have COVID? And so all you've told them is that for that day, they're not positive.
But isn't it that if we did have really good tracing, like has been started in New York and what Baker is trying to do, that in fact it would, if you're positive, then in a sense, all of the people that you've dealt with could also be quarantined. And otherwise, how are we ever going to kind of limit this in the community? I guess I just don't understand that piece.
Yeah, I mean, the contact tracing works up to a point. I think it's a good thing, but obviously people don't know all the people they were at the protest with, so it's not going to really help on that. I mean, I can't give you a scientific answer. I also think it'll be interesting. There's some research coming out now, again, we'll have to see, that says that asymptomatic patients are less likely to spread it. So that would be good. Then we're less worried about testing all the asymptomatic people. So I can see the arguments for both sides, but we definitely don't have the capacity to do it. And again, then, if you take it to an extreme, are you going to test everybody in America every 3 days?
Next question.
I had a self-administered test. I'm sorry, I'm not sure. Heather, can you explain? I'm not sure I understand the question.
Hang on while I unmute myself. First of all, my PCP is from a different hospital, and it took quite a while to explain why I needed this, but CVS was doing tests where you went through their drive-through and you actually had to administer the swab yourself. And I was pretty intense, but I don't think I'm as intense as a staff person would have. And I don't actually trust that test because I don't think that I necessarily went far enough to get a sample. And I was just wondering, in your drive-through, is it a staff person that's administering the test?
Yes, it is absolutely a staff person who has been trained to do that. It is not self-administered.
Got it. Because I have a lot of people who can only get those CVS tests and they're feeling like they're okay, and their reasons for getting the test are often, having contact with somebody who might be at risk and they don't want to infect someone.
So why do they feel they can only get it at CVS? Again, this is where we probably need to get the information about, right?
Okay, so
now we are testing you. If you call your primary care provider and tell them you have had contact with somebody who was positive, you can be referred for a test.
Yeah, it's the opposite. It's sort of the opposite. It's wanting to have a snapshot test before you go to help an elder or somebody at risk at a one-time thing. And even if you've had exposure, there are physicians from a different health system that still won't, because I had both exposure and not wanting to expose somebody else and couldn't get a testing order.
Okay, well, you should switch to one of our PCPs.
Yeah, I am actually in the process of switching, but that's a personal political kind of a measure.
Yeah.
It was just more about there are a lot of people I know who want to get tested just to reduce risk in an immediate situation. So,
And I understand that
sounds
desire.
logical, but
I understand that desire, but again, they could test negative and 2 days later be positive. So
right.
They have to really, it should not change what they do. Again, if they are the very few test positive, then they would probably take additional precautions. But if they test negative, all that says is that day they were.
That day they were, yeah. I mean, I kind of understand that, and it's, I think my tactic is to try to educate people about how to take greater precautions.
Exactly.
Right, self-quarantining and doing those things in the, prior is part of the solution to that too. That if you want to see someone thinking about quarantining for 14 days or something ahead of that versus relying on, a test that could test one, that you could just be not testing positive yet and test positive in 2 days. So there's other things people can do.
But also, I mean, the masks really make a difference. I mean, it's important to note that, we were pretty early on in the universal masking. Thanks, Heather, for showing us. And we have had very little incidence of employees testing positive. And even in the units, and the few that have, we're not in the units where we had lots of COVID patients. So it was, we don't see anything that makes us think they got it at work. And so, and obviously we have hand hygiene everywhere, but I think it shows that if you do that, it really makes a difference. So I just think that, it makes me a little crazy when I go out and see people not wearing masks, because it seems like a pretty easy thing to do that has a clear impact.
Speaking of masks, Joanne, I have a kid-like question, and I'm gonna then turn it back over to Heidi, but 2 parts to my question. One is, I read that if your mask is homemade and it's only 1 layer, that's really not giving you the protection you need or the protection to prevent someone from having contact from you. And so, I'm hearing that your mask needs to be, if it's homemade and made of cloth, it should be 2 or 3 levels or layers. And then the kid-like part of the question is, how do you keep your eyeglasses from fogging up with the mask on?
So definitely different masks have different levels of protection, but we are not going to have the whole country wearing N95 masks, right? You're always balancing risk and what it does to our lives. So if we really want to do nothing but care about risk, we would all lock ourselves in our houses, wear N95 masks, and never come out again. But that's obviously not the kind of choices we make. So it is true that the N95 masks are more protective than the surgical masks, and the surgical masks are more protective than the homemade masks, and 2 layers are better than 1 layer. Wearing it right is better than not wearing it right. And so, I think that you can now get the surgical masks at CVS. I've seen them there, although I think they limit how many you can buy. But we also, like at the hospital, when we give surgical masks every day to every employee, and we also let them take them home, and you can use, if you're not, particularly for someone like me, I don't have to wear it when I'm in my office alone, so I'm not wearing it that many hours a day. I take it home and I use it when I walk. So, I think people should get the best mask that they feel comfortable wearing. I don't have a secret idea of how to deal with the glasses. Maybe somebody else does.
Well, I couldn't resist giving you that highly technical question.
Although the surgical masks have the, you can pinch the metal at the top, so that does, I don't have as much of a problem with it as the cloth masks.
So Heidi, you had another question, I believe.
Sure, thank you. Okay, so back to testing. I'm sorry to
That's okay.
keep coming back to this. I'll ask a very specific question. I think it might be illuminating. So imagine an employer and an employee who is starting to avail themselves of these reopenings. And let's imagine that the employee is, 100% safe, as much as that is possible, in their life all the time with masks and hand washing and stuff, and that there's only one sort of potential exposure point, which is maybe travel outside of state to see a family member who is not, there's no known exposure whatsoever. They're taking all the precautions that they can on their travel there. On the way back, the person that they're visiting has also been as safe as they can be. And then they come back to state. I'm wondering whether testing can help keep the rest of the people who are, like staff people, safe, and at what point that testing would be the most likely to be illuminating. So in other words, I understand the idea of you test, well, it might be negative today, but it could be positive tomorrow. But imagining only just one block of time that there's a possible exposure, would testing like immediately upon re-entering the state be the right timing, or would it be like let 3 days pass before so that it can take hold? Or
Yeah. So I don't remember the exact number of days, and certainly we get that. And I would say this information is evolving, but it's definitely a sense that's not the day after you're exposed. It's several days after, and then there's a period of time. The 14 days is obviously a sense that after 14 days, if you didn't get sick, you're unlikely to have caught it. Some people are saying that can be 10 days. So we can get you more information from our infectious disease physician, but there is that period. I don't know, Julia, if if it's like the 5 to 8 days after or something like that.
Yeah, I think it's been that most by day. I think we're maybe at 11, but certain in terms of if you're going to get sick, the probability is you would have by then. But I think the guidance for people from the state for people coming back in who've been somewhere else is to quarantine for 14 days. I'm not sure that's changed.
so
My
really,
barber, I was
it
going to
doesn't sound
say
like
that
you're talking about testing being able to be helpful to shorten that 14-day quarantine at any point. Like, if they could get tested on day 2 and stay quarantined until their result, then maybe they're only out of work for 5 days or something.
No, because they could
No.
convert on day 7.
Right.
Thanks.
I was just going to say, I think the recommendation is still 10 to 14 days. My barber went to Florida, of all places. And of course, I haven't had a haircut in 12 weeks. And he came back and was scheduled to reopen, and they reminded him that he needed to stay home for 14 days. So I think as we head into the summer travel season, that's a great question. So thank you, Heidi, for following up on that, because who knows, we just don't know what to do. And once we get to our destination, what do we do? And then when we come back, what do we do? So thank you for that. Next question, I think Linda Tamburella, you had a question. Why don't you ask it?
So I'm interested as we're reopening in more like people's perception of feeling safe. Like how can we, so I'm a psychotherapist and I'm very interested in helping the downtown business community in any way I can and supporting reopening. And, everybody that I talk to and see and seen has different perceptions about what's safe. So how do, I don't know what's real, what's true in terms of somebody going into a store or eating outdoors in a restaurant, because the people, people definitely have so many different perceptions about what they can touch or not touch. And eating in a restaurant, having somebody serve you, even if it's outside. So anything you can.
Yeah, I mean, again, I guess I would remind us that everything has risk. We're always making decisions that are about how much risk you're willing to take. In general, we feel very comfortable with, if you're going to choose who to read and who to trust, is to trust the CDC. And then we certainly feel very fortunate to be part of Mass General Brigham because there's tremendous expertise there in terms of infection control. So we tend to look towards those experts and trust them. And I think that the governor's got some good people around him, including some of these people from Mass General Brigham who are advising him, but he's also got pressure to open up because the financial recovery is important as well. I think, look at the CDC. It talks about the importance of masking and cleaning surfaces. And I think the most recent doesn't say that you have to clean every, that takeout food is okay and things like that. But it's always that balance of how much do you want to take risk, which is relatively low but real, and also what risk category you're in. Obviously, at my age, I take more precautions than probably my kids do. I know people are looking for some magic answer. Nobody knows all those. They're constantly evolving, and that's why they're trying to open up slowly.
So Leslie, you had a follow-up point and question.
Sorry to be harping on the testing, but it does feel like this is a bit of a different message than I've been reading and understanding. So in the Globe today, the governor said that Massachusetts has the capacity of over 30,000 tests a day. And in fact, we're quite low now. We're only using 8,800. So I guess what I was wanting to understand from Joanne is, it doesn't seem like you're very positive, to use a bad pun, about testing. And I'm wondering is the solution in the short run that you're focused on is just getting people to wear masks and not encouraging more testing, like whether it's demonstrators or people who don't have an association with a doctor at Cooley?
So I feel like maybe I've in trying to make a point, made a misimpression. I'm not against testing, and we have more testing capacity than's being used, so I'm not surprised by the governor's finding that even though we were pushing for more testing capacity once we had it, early on we really didn't have enough to do the number of people who are coming to us, but now we do, and we have a little bit more. So we could double the amount of testing we're doing. That is different than opening up the floodgates and saying, the entire community should come out and get tested. So I think more testing is better. I think it'd be great if and I know they're looking at other ways to do testing, so people could do self-administered tests that we felt were accurate or saliva tests. I just want to be clear that testing in and of itself is not a precaution. And you could test everybody and still have tons of spread if you weren't wearing masks, using social distancing, and doing hand hygiene and cleaning off surfaces. So testing is a tactic, but I think some people want to believe, because we're also desperate to get back to quote normal, that if we just had testing, I wouldn't have to do all these other things. And that's not the case. So I hope there's still more and more testing and more people, particularly if they've had known contact, and if it's likely that the protesters feel like there's contact, that might be a reasonable reason to do so, but not instead of doing all the important diligent activities. Is that a more nuanced message?
So what is the rest of the region experiencing? I know a few weeks ago, you and your colleagues did that really terrific video that gave us the very simple things to do. So thank you for that. So what are they experiencing throughout the rest of the region right now?
So I have to say there's a few positive things that have come out of this time. One is the increased use and acceptance of telemedicine that I hope will continue. And another is the increased collaboration among the hospitals in Western Mass. We have continued, and I think we will continue to speak at least weekly, and just comparing notes, finding out who's having trouble with what issues. And in general, we're all in the same place. So Mercy, Bay State, Holyoke, and we also include Berkshire a lot. Everybody's kind of reached a lower level of incidence. Everybody's starting to open up. Everybody's has more testing available. We actually talked about the fact that everybody had the same experience that Cooley does, which is that now there is more testing capacity than people coming forward. Again, I think that, there were many, many times in the past couple of months where we really were limiting testing, so I understand that. So I think Western Mass has continued to be in a much better position than in Eastern Mass. The virus came here later. We have the, I think we had more time to have people start following all of the rules that allowed us to reduce spread. And we were really all able to handle the surge we did have. That's why you didn't see in Western Mass, we actually made a decision as a group of CEOs to suggest that the state not open up a field hospital here like they did in Eastern and Central Mass, because we could see from the numbers that we were going to be able to handle any reasonable surge after we got through the first few weeks where people thought it was going to be hundreds and hundreds of ICU patients. It became clear that wasn't the case. So I think the Western Mass is a pretty good place to be right now. And we just have to have people not take that success of a lack of spread as a signal that it's okay to relax. It's actually the reason that it shows it works.
Are you finding that your patients are, I guess, willing at this point to come and go back to seek your services, or is there still a hesitation?
I think it's a combination. I mean, we've only started last week to open up, and we're calling the patients who we believe are the most in need, so they're the most likely to come back. When we start having the ability, when we take the step in a few weeks of calling people, let's say for their annual physical, it might be a different answer. So not everybody, people are making choices about what they feel comfortable doing. And I think we also, Julia's doing tons of work to educate them that they're not coming back to the practice that they saw 4 months ago. They're coming back to a very different place where people are taking extreme numbers of precautions to help protect them and to help protect our staff.
So when you gave your opening comments, you mentioned advertising, and I missed that point. So what is the messaging in the advertising that you referenced?
Julia, do you want to, you'll articulate it better.
Sure. Well, we are, as Joanne just talked about, concerned about people delaying needed care. And particularly if people are having any kind of life-threatening symptoms, illnesses, injuries, we really want to encourage them, to come in and seek that care. So in order to help really reassure the public, we have messages out that are really about our safe care commitment and the ways that we are screening visitors, screening patients, screening staff, protecting people, cleaning, ramping up. And we have extensively through this, all the infection control measures that we have, all the infection prevention. And so just really trying to educate people about what we're doing and our commitment to keeping them safe when they come into care. To again, try to reassure people and encourage them, when you need healthcare, we want to see you, and we're doing everything we can to make that a safe experience. We also have a lot of people taking advantage of telemedicine. I think that's one of the things that has just really kind of expanded almost exponentially, during this crisis. And so there's opportunities for telephone and video visits with primary care physicians, specialists in our physical therapy departments, and and elsewhere in the hospital. And so that's another thing that people can take advantage of if that's appropriate for them.
Thank you. Next questions from anyone who's participating.
Can I ask a question of the group? We would love to hear feedback on what is the best way for us to get these sort of dual messages out about this is not the time to relax, it's the time to continue to be vigilant even as we open up, both the hospital and the community and the businesses, and then the importance of coming in for care and not delaying needed care and screenings.
I'll just say, I think that the messages that Julia just talked about, which is reassuring the community of the precautions and steps and protocols that you are doing in the hospital is key. I know my son is looking to reschedule elective surgery at another hospital, and he's just very, very worried about walking into a hospital. I mean, previously, especially with COVID, it was like, don't come see your doctor. Don't go into the hospital. Just stay home. And so the hospitals, I think there was an impression that they were not the place to go. So I think that a lot of education about safety is really important. And I think that's true of any place where we go now. Any place. It's very reassuring to see the protocols that, whether it's your hairdresser or the restaurant or the hospital, whatever it is, these are the protocols that we're following. That makes people feel more comfortable that they're reducing their risk, to use your phrase.
Thank you, Ruth.
Anyone else want to add to that question that Joanne asked about the dual message of helping people feel safe, but also the message of what you need to do to stay healthy? I just appreciate that every email from every person that I get at Cooley gives me the 3 things that I need to do. So I love that it just reinforces the importance of, wearing a mask and washing your hands and social distancing. So thank you for that.
We stole it from the state. We didn't even ask their permission. Heather?
Yes, the communities that I interact with the most, like the low-income housing where I live, and the people who live on the street, and many people whose first language isn't English, very, very rarely use email. And the most effective thing is a 3 to 5 minute YouTube video that can be shared on Facebook.
Okay.
So, and you probably have a Spanish translator who can do that in Spanish,
Yes.
and that would be amazing.
Yeah.
We also have some people over in Amherst that speak primarily Cambodian. So that would be helpful. That might take a little more work, but those things, having something 3 to 5 minutes long that I can post on my Facebook and post to all the Facebook groups, because that's how a lot of people who don't have a computer and just have an Obama phone communicate, is Facebook groups.
Yeah.
And if you can do that, that would be awesome. I can get it out there.
Great.
And that's a great suggestion, and we can certainly I think there are some of those on our website, and we can certainly post them to Facebook as well. So thank you for that.
Linda, you had something you were going to suggest?
Well, I think just what you've said today is very reassuring too. Just saying the protocols work, getting that out more and more. And I think that's what I was sort of asking before. I think letting people know what is working, and that everybody's following them, in healthcare and in the businesses. And so just people just need reassurance over and over again. I think it's like the message. We're thinking of you, we're taking care of you. And sometimes even more specific, like I've had 2 experiences with checking a problem with my eye, and one where it was, I was the only person in the office. So this was weeks ago. And then another one where I was waiting a long time and I wasn't sure, was that okay? I was in a separate room, but I got anxious. So
Yeah.
I think, and I did call and say, I asked, well, what's the protocol here? So I think if people who answer the phone at an office or the hospital, people just, this is what we're doing.
Yeah. No, it's a great point, and I should add that we actually did a practice-specific review at every single site for what made sense at their site to ensure that they were safe, because we have lots of different kinds of buildings and sizes. So in some, our waiting rooms were large enough that we could allow a limited number of people to wait in the waiting room, and it would be all separate, and we created those separate places. In others, the waiting room is a size that really that's not going to work, and so in that practice, they will might require as opposed to allow, and the other ones for people to stay in their car, and they'll be called in when they come straight to the waiting room. So it really, a lot depends on the physical layout, and we've gone through and had both our medical director of our community practices along with our infection control nurse went to every single practice over the last 2 weeks to develop a practice specific set of protocols that makes that assure that practice will be the safest.
Yes, thank you.
Next question, anyone?
I just have one fast question, which
Sure.
is just about economics. I mean, I'm wondering if someone does have a video appointment or an audio appointment, does the hospital or the practice get as much money as when you're coming in?
So great question. So at the beginning, why didn't we do all this telemedicine years ago? So first of all, I would say that in both providers and patients sort of weren't necessarily embracing it, but also we didn't get paid, or we got paid very little. So one thing that came out of COVID is the insurers did indicate, although it took a few weeks to get some clarity about it, that they would pay for at least a video visit as if it were an in-person. Depends on the payer what they do for the telephone visit. But we don't know how long that will last. We are advocating that it continue permanently, because it's actually for many people a very good way to get care. If you have mobility problems and have something that can be cared for, it can actually improve access. Obviously in our hill towns, we have to deal with the fact that not everybody has that bandwidth. But right now, we are getting paid as if it were an in-person visit. So that is helpful, and that doesn't cause yet another gap in our financial issues. And you should just know Massachusetts has been behind almost every other state in this regard, which is why there has always been less telemedicine here than in other states. And it's beyond my understanding why in a state like this that we were so slow to adopt it. But I think we're not going to go back to the old way. People have seen too much how it can be helpful, not always, because there are times when you clearly need to see your provider. And I would say particularly our providers who really value their relationship with their patients, they are very excited to start seeing some patients again in person. They really miss that connection.
So there's also another issue with that, though, that I tell people about. There is the gentleman who's doing the research is actually from Tufts, and there's no problem with that kind of communication in a closed system like the hospital. But once I have that conversation with my provider on my Android phone, Samsung has access to everything that is said or viewed, and my ads change. So my information is private inside the medical system. It is not private to the proprietary software on my PC or my phone. So I'm still going to have my appointment, but I'm going to get barraged with ads that are coming directly out of those conversations.
So I think that's not true if you're using the video, because we now have the video. So this is only as of a few weeks ago, where the video visit is actually in our electronic medical record through our Epic system, and that has all that privacy. The early ones where physicians had to just use their private phone, that was an issue. But
no, my phone.
Right. But if you're on the computer on the video in your electronic medical record, then that takes that risk away, I believe.
I think so, because it happens through the portal.
Yeah. But
Okay,
again, that's
so
why it's so important.
That must have changed since my first 3 appointments, because I did have that happen.
Yeah.
So that technology has been added. That is a really good thing for me to know, because that's a thing that I can help people be more willing to do that on their phones, because at times when they have and they've gotten ads, then they don't want to do it anymore. But if that problem is fixed, that is really
if they're using the Cooley portal, the Epic portal, that so that may not be true at some of the private physicians who have their own system, but the our
Yeah, this was Bay State, so I'm gonna assume they fixed
yeah,
it.
probably, but it's
I hope.
yeah.
But good to know that you have it fixed. Thanks.
We've got
Joanne, a
time.
follow-up question on that.
Yeah.
So are your docs required to use the Epic system when they do telehealth with their patients?
Yes, for now, for video, I'm just not sure. We can get back to you on whether for those patients who for some reason don't want to or can't use video, whether the telephone call goes through the Epic system or that's still through the private phones. Julia, do you know?
I'm not positive. I'm not
Yeah,
sure.
yeah, we'll have to check that. But certainly for video, once we embed it into the system, and there was very little video being done before that because they were just using the phones. But once we got the video into the system, then they've been trained and they're expected to do that.
Yeah, and flip phones don't have video capacity. I know some elders with flip phones.
Yeah. We'll find out how it works on the phone calls and whether, I don't know how that would work.
Thank you very much.
Numbers going down at the nursing homes?
Well, they're not going up as fast. I mean, people have had it, but there'll be, a little outbursts in different nursing homes where you get sort of 2 or 3 at a time. We haven't had the kind of high numbers that we found when we first did all the testing.
Joanne, another question. What's the latest thinking from the ID docs about a surge in the fall?
I don't know.
Okay. Is that an assumption in the?
I mean, I think what we think of it more as we plan for it so that we're prepared for a second surge, and then we hope it doesn't happen. So I'm not sure where people are now. I mean, certainly a couple months ago there was a belief that it was really highly probable. I think people are a little bit more optimistic now because we've seen sort of that these interventions really help and that the public is willing to do them. So I'm feeling a little bit more hopeful that we can avoid a major surge.
Was there something that happened with the numbers in Massachusetts on June 1st, some different kind of counting that accounts for this enormous spike that we see on that one day and reported cases and deaths?
I think they started including those who tested negative but were highly likely. We have patients who test negative, but they look like a COVID patient and we treat them like a COVID patient. And so I think they started including those.
So that wasn't some little mini surge.
Right.
If no one else has a question, I do, which is, I just wondered, with all of the financial losses that you're talking about, I'm wondering if you feel like if there isn't that second tranche of money from the feds, that you're going to need to face furloughs or layoffs at Cooley Dick.
I mean, I think we are talking about having to make some tough decisions in the fall. We don't know yet 2 things. One is how much of the federal dollars will come in, and 2, how quickly volume will ramp up. I want to be clear, we're not encouraging that volume because of the money. We're encouraging it because people need care. And it will make a huge difference on our finances. So, but we're certainly having planning for what we'll have to do that will reduce our expenses to come more in line with our revenue. So we'll have to make some tough decisions.
Next. It is 9. I understand we had an hour, Joanne. I know this was a tough day for you to schedule, so I thank you for making it happen with us. So is there one final question that anyone has that's really burning for you? Julie, I know your hand isn't raised, but.
Well, I want to say thank you. And, we actually appreciate these opportunities because these are nuanced messages and they are hard ones and people have a lot of emotion behind them. People are fed up. And then on top of that, and I don't want to leave this meeting without at least mentioning how this second crisis and how important it is for us all to focus on the issues of racial justice, and that affects all of our health as much, and certainly for a longer period of time. So I think the more people can get educated and help people not jump to, if I could just have testing, or what if I wear a mask and I don't have to do anything else. These are more complicated answers, and it's all this, how can you reduce the risk in a way that you can still function in the world?
Well, thank you so much. We just appreciate your leadership. We know that you touch so many organizations as a partner, and we're just grateful that the Chamber is one of those. So we thank you for your partnership on so many fronts. And Julia, I thank you for your collaboration and working with me to make this happen. I really appreciate it.
Thank
Thank
you.
you. We appreciate it. We appreciate everyone joining.
Yeah, stay safe.
And let me say too, for all of the participants, they had to go to the command center, I'm sure, but thank you for making this a rich and really wonderful dialogue. I learned so much, and I hope you got your questions answered. And again, if you want to refer back to the comments, just go to our website, northamptonchamber.com, and you'll see the COVID-19 link, which will have this recording in the next day or so, along with all the COVID-19 resources that my team and I have been archiving for your reference. And just stay tuned to the communications from the Chamber as we continue to get the information out. So I hope that everyone has a really wonderful day, and thank you again for joining us so bright and early this morning.
Thank you. Bye-bye.
Thank you.
Thank you. Have fun, everyone. Stay healthy.